Hi, I am Dr. Huck. I'm an endocrinologist. In this video, I will briefly explain Continuous Glucose Monitoring System or CGMS, one of the most significant advances in diabetes management over the last 30 years. For a long period of time, patients with diabetes monitored their blood glucose using glucometer. Depending on the type of diabetes, many patients had to prick their fingers several times a day, and even then, they got a snapshot of glucose reading at that particular time. Most patients could not check frequently enough to see the effect of food, stress, activity, and medicines on their glucose readings. Continuous glucose monitoring was developed in response to these limitations and as a way to monitor glucose readings on a more or less continuous manner with less inconvenience to the patient and providing more data at the same time. Now, before I explain what CGMS is, let us look at this example. This patient, quite active in his life, noted that his glucose reading was 80 before lunch on this particular day, and by the time he ate dinner, it was 121. Now, between these two, he had no idea what his glucose readings did, and such patients oftentimes were surprised in the past when they went to their doctors and found their hemoglobin A1C to be elevated. Continuous glucose monitoring system helps solve this problem. CGM is worn by the patient on their abdomen or on the arm. It gets changed every 10 to 14 days. The sensor is a small tube inserted under the skin, and it measures glucose reading in the fluid around our cells called the interstitial fluid. The sensor itself is attached to a transmitter, and the transmitter helps send the data to a display device provided by the manufacturer, or increasingly now, it can be displayed on smartphones using apps provided by the manufacturer. Thus, with CGM, you can get a fairly detailed picture of what your glucose readings are doing throughout the day because you're wearing it all the time. You can rest, work, shower, or sleep with it. You can even swim with it. Once you get used to, you won't even be able to tell that you're wearing it. And because of that, you are able to get glucose data throughout the day. The value of this continuous glucose monitoring is best illustrated in the case I presented to you a couple of slides ago. Remember, the patient had a glucose reading of 80 before lunch and 121 before dinner using a glucometer. Well, that same patient was wearing a continuous glucose monitor as well. And as you can see here, after he checked his glucose reading before lunch, his glucose levels actually dropped, and then he ate a large lunch in response, which led to glucose readings rising up to 300 milligrams per deciliter. But by the time dinner came, the glucose levels had dropped to 121. So all of this action would have been missed if he was just relying on his glucometer reading. So this kind of detailed information can be quite useful for patients to plan activities that may lower their glucose readings or their meals that cause their blood glucose to go high. They can also judge accurately how much insulin or medication they need to prevent glucose readings from rising. Ultimately, this kind of feedback improves patients' ability to get the A1C in good range, without risking hypoglycemia or low blood glucose readings. So in addition to the absolute glucose value, the CGM systems also provide predictive glucose information for the patient. This is quite useful and is not possible without CGM. This kind of information helps patients avoid hypoglycemia by taking actions before hypoglycemia hits. Or if they see this pattern happen repeatedly, they can adjust the dose of insulin without overreacting. A particularly useful feature of CGM is the ability to set alarms, particularly for low blood glucose readings. This can be quite useful in pediatric patients as well as those who have diabetes, who have had diabetes for a long time and may have lost the ability to recognize early symptoms of hypoglycemia. Continuous glucose monitor helps patients in several other ways. It is very useful as a behavior modification tool. By providing information about the glucose in response to food and exercise, we commonly notice that the patients who have their CGM and they wear them regularly, they tend to eat better, exercise more often, snack more wisely, and are more consistent in taking their medications and insulin. Most of our patients report improved quality of life and reduced stress when they're wearing CGM. There are 4 major CGM systems in the US at present. Dexcom currently has Dexcom G6 in the market, and Abbott has Freestyle Libre or Libre 2 as their latest CGM. These two are standalone systems and can be used either with insulin pumps or with insulin injections or even with diabetes tablets. A newer CGM system is called Eversense. It's an implantable CGM which needs to be changed every 3 months and requires a minor procedure for placement of the sensor. Medtronic has a standalone CGM as well as one that is integrated with their insulin pump, thus providing what is called a closed hybrid loop system, which eventually, hopefully, will develop into a artificial pancreas system. Some of the technical details regarding CGM systems vary depending on the systems. So in this slide, I've listed the main CGM systems, the support number, and the web link where you can find more information, as well as demo on patients actually using the systems. This brings us to the conclusion of this video. I hope the information was useful for you and help you understand some basic stuff about CGM. The video is not intended as a substitute for the professional medical advice. Please consult with your healthcare provider to determine the appropriateness of continuous glucose monitoring in your case. And in case you have a CGM system, please refer to their manual and instructions from the manufacturer for details. Goodbye and good luck.